Coming up, we'll be on location at Sollay Cosmetic Medical and Laser Center in Baltimore, Maryland, discussing Mirror Dry that permanently and immediately reduces underarm sweat and odor and also removes hair permanently with one of this area's top doctors, Dr. Terrance Baker. Welcome, Dr. Baker, to the Top Doctors Interviews. We're looking forward to this interview with you. We're going to talk about the Mirror Dry treatment procedure that is a really cutting-edge new procedure that has helped a lot of people and is helping a lot of people eliminate the underarm sweat, can also eliminate hair as well. So we'll get into that. But first I wanted to talk about the Sollay Medical, Cosmetic, and Laser Center here to talk about your vision, because you guys offer so many different treatments. You offer cosmetic treatments, whether it's body contouring, facial rejuvenation, anti-aging. You offer weight loss, and you offer medical treatment and procedures as well. Can you share your vision about the practice and what you were looking at when you set this up?
Yes. Back around the year 2000, we opened up a general family practice here in the Baltimore area. And the goal was to provide family medicine care through my nurse practitioners, who are also board certified in family medicine. And myself, I'm board certified in family medicine, geriatrics, emergency medicine, and forensic medicine. We had a dream which was to expand the traditional model of family medicine and to add some additional services. And the first service we actually added was pain management. We saw a lot of patients coming into the hospital being referred to us who had pain from sports injuries, car injuries, getting older, osteoarthritis, rheumatoid arthritis, and a variety of painful conditions. And one thing that was in common is many of them were using medications, particularly controlled medications like oxycodone, OxyContin, Percocets, Percodans, those type of medications. And so what we did is we began using medical therapeutic lasers to treat patients with painful conditions, and we were amazed at the ability to reduce the pain and to reduce the amount of medication that they were using. Our first office was at the Good Samaritan Hospital in downtown Baltimore, and the security guard, I don't know they ever knew the name of our practice, but they always remembered it as the practice where miracles occurred, because patients would come in wheelchairs, and a few weeks later they would see patients walk out. And the reason being is that we were providing, pain management using medical therapeutic lasers to reduce the pain, the inflammation, and to get the patients back on their feet. I'll never forget one October, about this time of year, a patient came to us, an elderly woman. She said, "Dr. Baker, I have just one dream, and I understand that you might be able to make that dream come true. I have tremendous arthritis in my knees. I don't want surgery. I'm too old for surgery, but I want to cook Thanksgiving dinner for my family one more time. And do you think over the next 2 or 3 weeks that we might be able to reduce the pain in my knees so that I can stand and cook that meal for my family?" And sure enough, we brought her in 3 days a week. We provided a course of treatment for her, and sure enough, she realized her dream and was able to cook Thanksgiving meal for her family. She's one of those patients that came in through security in a wheelchair, and 3 weeks later left walking to cook dinner for her family. So that's how we started. And then subsequently we noticed that our patients needed additional services. For example, patients would come in and they would have excessive ink, tattoos, or sun damage in all the wrong places, and they were looking for a new job, or maybe they'd already gotten a job. And here in Maryland, federal and state jobs often require no visible ink. So what we did is we purchased our first medical therapeutic laser for removing ink, an Astanza unit manufactured here in the United States in Houston, Texas. So we bought the Astanza. The next year we bought a Fotona, which is in Europe, from Europe, and is the top recognized laser for removing tattoos and ink and pigment in all of Europe. And so we had the Fontana, we had the Astanza, and we began removing ink. I can't tell you how many hundreds of people have come here with tattoos on their neck, their face, their hands, their arms, different places where their new employer just doesn't want ink. And so we went into the business of removing ink. The next thing we did is we love to help patients slim down and to be smaller and fitter because every medical condition in a family practice requires better body weight. Being smaller, being within your BMI, weighing less, in general helps diabetes. It helps hypertension. It helps osteoarthritis. It helps rheumatoid arthritis. I'm hard pressed to think of a medical condition that weighing a proper body weight doesn't improve. It virtually improves every medical condition that you can think of. And so we began helping people to trim down. But then when people trimmed down, they would have extra skin, loose skin, and their shape wasn't what they wanted. So they weighed less, and they were very happy for that. They'd lose 20 pounds, 40 pounds, 100 pounds. Some people lost over 200 pounds. But they'd have this extra skin problem and didn't necessarily have a budget for surgery to do a tummy tuck or facelift or chin tuck or any of those kind of tightening surgical procedures. And so we purchased the equipment necessary to tighten the skin up using medical therapeutic lasers. And now what we do is we help you to trim down by dieting and, of course, exercise. We help you to use medical therapeutic lasers like sculpture and UltraShape Power, which uses ultrasound waves to permanently destroy fat cells. And while we're doing it, we also recommend that simultaneously we begin a process of tightening you up. And we'll use the VeloShape by Candela to do that. And we have other pieces of equipment, medical equipment also, that can help to tighten up the skin, like TempSure, for example, uses radio frequencies to tighten up the skin virtually everywhere. Face, neck, chest, abdomen, vagina, labia, legs, everywhere. And so, we have also have the TempSure equipment for tightening. The next thing that happened is once we help people to trim down and tighten up, then they wanted to take some years off. For example, have you ever seen a 70-year-old face that looks any better in a man than mine today? And I'm not saying that I'm beautiful or handsome or anything like that. I'm just saying that I had a lot of acne problems as a child. But using technology that we offer here in the office, I've been able to smooth a lot of that out. And what I say is take 10 years off. And so from time to time, my nurse practitioners treat me with the very same technology that we offer to our patients to rejuvenate the skin and essentially return the skin back to a more youthful appearance, basically roll back the clock about 10 years. And there's a science to that. It's not just physically you look better, but also we actually know from dermatology studies that if you biopsy the skin after treating it with medical therapeutic lasers and radio frequency, that you actually elongate the telomeres. Now, what are the telomeres? The telomeres are like clocks. They're like cell clocks. And every cell in your body has a clock. And we're designed, in my opinion, we're designed to last about 100 years. So that's about what we're designed to last. That means that every cell in your body has a clock attached to it called a telomere. And those telomeres essentially allow the cell to know how old it is and how long it has left to survive. And that's important because each time the cell replicates, that each time it makes a new cell and reproduces itself, then what happens is the telomere shortens. And so you eventually get down to no telomere and tick-tock, 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 your time's about up, okay? But by applying energy, that is laser light energy, medical therapeutic lasers, and by applying radio frequency sound waves, we're able to roll that clock back. That is, we're actually able to elongate your telomeres for the areas that we treat, which typically is face, hands, back of your hands, your neck, sometimes in women, the anterior chest, because ladies like to wear a nice V-neck like I have with my sweater today. They like a nice V-neck with some pearls or something like that, attractive. So they like that, and they want that area to be youthful appearing and to look the best they can. We all do. So that just gives you an overview of how we have developed this practice to where we are today, Sollay Medical Center. So that gives you a little update, just a little snapshot of the practice over the last 20 years. of where we started, where we've come to, some of the procedures that we do. At the end of the day, we're a general family practice that has some specialty niches that we believe are beneficial to our patients. Our patients love it. We can take care of your hypertension, your diabetes, your osteoarthritis, and we can do your sports physical for your children. We can do well child checks, well adult checks. But at the end of the day, we can also help you with your appearance and your function.
Well, I love that approach, Dr. Baker. It's a tremendous approach. I mean, you founded this practice based on the medical side of it. It evolved naturally through the process as you found other needs for patients that fit into what they were looking for and what you could provide. And you've become a wonderful one-stop practice that offers every aspect of not only health care, but cosmetic, our appearance. Every aspect of a human being is tied together. And you are utilizing that approach that your health, your weight, your appearance all work together. And if you can provide all the services in one place that can help people, they don't really need to go anywhere else.
No, I think that's true. For years, family practice doctors, we help patients to control their medical conditions, starting prenatal. For example, this practice for years delivered babies. We've delivered over 1,200 babies over the years. We no longer deliver babies, but that's just because of I guess, the political environment where now babies are usually delivered in just hospitals that only do infant care. But we do take care of infants. I think our youngest child is currently 4, but we see patients all the way up to our oldest patient being 112. So we provide general medical care across the board, not only here in the office, but we also do house calls. We do some street calls to homeless people who are on the street. We also do nursing home visits and work in the hospital as well. So the practice is a full-service family practice that has several special interests. And you are right. You really hit the nail on the head, which is we can not only help you with your physical disabilities and your medical conditions, but we can help you to be the best you that you can be.
Yeah, it's a great approach, and you guys are helping so many people in the community. That leads me to my next question. We want to kind of focus on mirror dry. Your practice offers some of the latest procedures and treatments that can help so many people. You're on the cutting edge, and one of those treatments is mirror dry. Can you tell us a little bit about what that is and how it's performed?
Yes, mirror dry is a procedure that was first recognized by physicians about 10 years ago using electromagnetic wave frequencies, heat essentially. We found that we could destroy sweat glands, odor glands, and hair follicles under the arms in a way that was pain-free, was timely, that is hour and a half to do the procedure, and that we could take away a disabling condition that has stopped so many patients from being all that they can be. Thousands of people have lost friends and lovers, have lost wives and husbands, have lost employment opportunities because of excessive sweating, just literally pouring sweat from under the arms for no reason other than they were born that way and they inherited. This is a condition that they inherited. So about probably 2 to 3% of the United States population has inherited this condition. Probably another 5 to 10% has obtained it from what I call environmental purposes. That is, they work in a very overheated environment. They take medications that make them prone to sweat. They also carry extra weight, which makes them prone to sweat. They're also out of shape, physically not as fit as they should be, which also makes them prone to have unnatural excessive sweating. All these patients can be tremendously resolved by the mirror dry procedure, which takes about between 1 and 2 hours to set up. Patient gets interviewed, they have an examination, they fill out a comprehensive medical form, and then the procedure itself is about an hour to an hour and 20 minutes in that neighborhood. So this is something for everybody that is having this medical condition. You don't need to suffer any longer. This condition can completely change your life. It can help you to get the promotions that you deserve and the promotions that you need. It can help you to establish relationships and keep those relationships. And it can all happen today. Literally 1 hour from now, every single person listening to this interview could receive the treatment and stop that disease process.
Well, it leads me back to that famous phrase that most people are familiar with, and that is, never let them see you sweat, right?
No, it is so true. We don't realize it. There's some things about people interacting. We're a very social nation. We like our relationships. We like our friendships. Our business relationships are often very cordial and very social in America. But that brings people close together. That's been one of the things about this SARS-CoV-2 pandemic that has really been distressful to so many Americans, is that we have to keep some distance, like you and I are today. Keep some distance, because normally we'd be closer together and and right up on each other. Today we're observing some social distancing. Why is that? Well, Americans like to be social. We're a very social nation. And the problem is, when you're social, if you have an excessive sweating problem, then everybody knows it. Your sport coat is soaked with sweat. Your brand new white shirt is soaked with sweat. Your new gown, you can't wear sleeveless gowns because you don't want people to see the sweat rolling down, the armpits of your sleeveless gown. And so, because of that, people remove themselves. They don't put themselves in that environment. People find it hard to get a job and keep the job, because a lot of employers think the patient must be sick because they sweat so much. A lot of girlfriends don't want boyfriends that have excessive sweating, and men certainly don't want a woman that's constantly having to go to the bathroom because she's soaked in sweat. And so socially, it's something that really disrupts establishing normal relationships with friends and family and employers. And yet here we are sitting here today, literally everyone listening to this 1 hour from now, an hour and a half at tops, could be treated and stop this disease process, because I do consider it a disease. It is something you inherit. It's something that's treatable, but nevertheless, it is a disease process, and it results in tremendous disability of Americans all across the country, both men, women, children. Everybody's equally affected.
Yes, and it actually affects so many people in society, and there's so many aspects of our life, as you so correctly pointed out, that the sweating can affect, whether it's our social relationships, our professional work environment. So it's definitely really important to get this addressed and treated. Dr. Baker, who would you say is a good candidate for this procedure?
Virtually anyone that has excessive sweating, like, for example, I myself have been treated. Most of my staff has been treated. It turns out that virtually everyone can have an improved health and improved social environment, from the patients that have the congenital disease all the way over to what I call the environmental disease, which is related to the factors we talked about: weight, exercise, being out of shape, medications that you take, those type of factors. So virtually everyone can be improved by this procedure. We first focus on those patients with a genetic disorder who are the profuse sweaters, the ones who literally within minutes can go from dry underarms to sweat pouring down. Literally, you'd think that they were in a shower and water was pouring down the sides of their arms. It can happen so fast and be so violent, the profuse sweating that they have. So we focus first on that 2 to 3% of American citizens with that level of disability. And then next we focus on those patients who have had the problem, but perhaps not at that level of severity.
All right. Dr. Baker, you said it takes approximately an hour for the treatment. Is it something that people can come in just during their lunchtime and get done and be back to work, or is there any downtime associated with it?
There's virtually no downtime for most patients. Most of our patients do it at the beginning of the day and then go to work. Some do an extended 2-hour lunch and they come in, get treated, and go back to work. Some patients do take the day off, but it's not required. For example, when I was treated, I went to the emergency room and worked a 12-hour shift afterwards. No effects at all. The most that's going to happen for the average patient is you're going to have some irritation, a sense of irritation for which a single dose of Tylenol will be more than adequate. Most patients don't even have that, but we're talking about a single dose or two of Advil or Aleve or Tylenol is all that is required by the vast majority of patients.
That's great. So it seems like little to no downtime, minimal discomfort, almost a no-brainer. I mean, just come in for an hour, get the treatment, and be back on your way.
No, that's true. We actually have people, we're just 20 minutes from BWI Airport here in Baltimore, Maryland, and 20-minute Uber ride over or yellow cab, either one. They can get treated, be back for their plane, and be back home in time for dinner.
That's very impressive. What types of results are your patients seeing from the mirror dry procedure?
Well, for the vast majority of patients, it's instant result. That is, immediately when the patient has done the procedure, they automatically recognize that the sweating has stopped. And a little later on, they'll notice that any odor problems they have, and then later they'll notice no hair returns, little or no hair returns. The vast majority of patients can be successfully treated with a single treatment. We do recommend that particularly for the genetic predisposed patients, that 2 treatments is recommended. But I've only had one, and I've had no return of my signs or symptoms of excessive sweating since I was treated. So it really depends on the patient. At most, it's 2 treatments, and for many patients, 1 will be adequate.
Dr. Baker, that's very impressive. Now, you did mention that it does eliminate hair. Is that for every patient? Is it a form of hair removal as well?
Yes, it is. It's very effective at removing hair. And what we find is, in reality, is that several months after the treatment, the patient may have an occasional hair that springs up. And what we recommend is either the patient will get the second treatment, which a percentage of our patients will get that second treatment, or we'll do a laser hair, literally a 1 or 2 minute little micro laser hair removal for those few hairs that remain. Some hair follicles are resistant. One of the nice advantages is we actually have some patients come in, like redheads, for example, that historically it's hard to use laser hair removal on a redhead, or very white hair, or very blonde hair. And so this procedure has that advantage of not only reducing and eliminating sweat glands, but also odor glands and hair follicles of all hair colors.
So you're really getting an additional added benefit of having the hair removal as well as stopping the sweating.
Yes, you are.
All right, that's wonderful. Now, Dr. Baker, is this a procedure that the results are permanent for the rest of our life, or is it something that we'd have to get done again in like 6 years or so?
Yes, the answer is that this is a permanent procedure for permanent removal of sweat glands, odor glands, and hair follicles. We know the body is very resilient, and sometimes it has the ability to grow back or rehabilitate some of the glands that we have destroyed or nearly destroyed. And that's why some patients will require second treatment, and some patients may require second treatment down the road, a year or 2 from now. So it's individual, it's based upon the individual needs, and each patient is unique. But in general, it is always permanent, and the question is, will you need a second treatment in order to get the results that you desire? We're not familiar, although we've heard in the literature that there are an occasional patient that requires a third treatment, but we have not seen that. We've not seen patients requiring a third treatment, but yes, a percentage of patients will benefit from a second treatment, either in a month or 2, or they just wait and see how they do, and then schedule that second procedure 6 months, a year, 2 years from now.
Well, it sounds, again, like I mentioned, a great procedure. Is it something that's safe, and is it FDA cleared?
Yes, it's FDA approved now for many years. The use of heat to destroy permanently sweat glands, hair follicles, and odor glands is FDA approved. The equipment is very safe, very effective, and the procedure is pain-free. The only pain that some patients experience is when we apply some numbing medication. The patient may feel that initial needle stick. We use very small, tiny needles. Some patients will perceive that. I did not, but some patients may perceive it, that initial stick, which might feel like drawing some blood out of a vein for a laboratory test. And then after that, the numbing medication takes over, and no additional pain is noted.
So there's minimal discomfort. It's very convenient. You can come in an hour and get the treatment done and be on your way back to work or whatever. And the results, most of all, or most likely, are permanent. Maybe 1 or 2 treatments may be necessary down the road, but mirror dry seems like a very safe and effective treatment and procedure. You're in and out in an hour, no more sweating, can eliminate hair as well, and that's an added benefit. So again, it seems like a no-brainer. Dr. Baker, you and your practice have established a reputation for excellence, not only in healthcare and wellness in the community, but offering some of the latest and most effective treatments for anti-aging, facial rejuvenation, body contouring, weight loss, a total one-stop for patients in the community. Can you tell us what you feel separates you and your practice from a lot of the other practices in the area?
Well, I think first off, it starts with experience. That is, our staff of nurse practitioners and myself, Modessa Vasander, Hannah Keeley, myself, are a team with over 100 years of experience. We have the unique knowledge, education, training, and experience to be able to interview patients, do the physical examination on patients, do the diagnostic testing, come up with a differential diagnosis, and then treat the patient. And whether we're treating them medically for their hypertension, their diabetes, their heart disease, their osteoarthritis, we are able to successfully do that here at Sollay Medical Center. Next is we have developed the specialized education in using medical therapeutic lasers, ultrasound frequencies, as well as the latest of technology to provide care to patients with unique needs. And we have a lot of unique needs. Patients come to us with acne and acne scars. We can treat the acne and we can treat the scars. We also do Botox and fillers here, so not only can we diagnose the acne and treat the acne medically, but we can also then go on and repair the damage using Botox and fillers, followed by one of our rejuvenation devices using either radio frequency, microneedling, like we have the Patanza here. Patanza is a microneedling that uses radio frequency at the same time. It's one-of-a-kind device. Nobody else has that type of technology. And we're able to repair the scars of acne. We have patients come to us with burns and injury from burns. We're able to work on the burn scars, sometimes the area from which the patient had a transfer of skin. We can improve the appearance of that skin, and we can remove the hair associated with that transplant. So there's so many things that we can do here in this office, starting with medical evaluations, medical diagnosis, and then offering to the patient the best plan, not only to treat their physical condition, but also to improve their aesthetic appearance as we want that patient to be the best that they can be. It's like the lady that came to us with osteoarthritis. Yes, we can provide her with the diagnosis, do the x-ray examinations, the physical examinations, provide medication, but at the end of the day, using medical therapeutic lasers along with medication, got her on her feet, and she cooked her Thanksgiving dinner. We do that kind of thing here at Sollay Medical Center day in and day out. We help patients to reach their goals, whether it's medical goals or it's aesthetic goals. We can do that because of our unique knowledge, education, training, and experience. Number two is we have the equipment. We have invested in over $3 million worth of cutting-edge medical equipment that provides state-of-the-art from leading manufacturers. We have 12 manufacturers represented in this office. They are all leaders in their fields. We can pick and choose the equipment that is best to meet our patients' needs, and we have. And so I think investing. Next is location, location, location. We have a great location, virtually unlimited parking, easy to get in and out, 3 interstate highways, crossroads of 3 interstate highways nearby, the airport, BWI airport nearby, the train station. People come in from New York, come in from Boston to get treated, come up from Richmond to get treated. And so we're sort of in a hub, if you will, in a place where patients can come to get the treatment that they need. They can come, get treated, and be home in time for dinner. And that's sort of become a slogan of ours. That one of our patients who flew in from Miami to get treated, she actually gave us that. She said, "Well, Dr. Baker, I flew up here because I really didn't want to go to any of the medical offices there in Miami. I flew up here to get treated. I'll be home in time for dinner, won't I?" And so I sort of borrowed that from her because it's true. And so patients do sometimes come because we have that unique knowledge, education, training experience, and we have the equipment to go along with that experience.
Dr. Baker, that was very informative. You're doing great work in the community. You're helping so many patients, whether it's their medical needs, their health, their wellness, improving their appearance. Also, I want to point out that your patient care is unparalleled. I mean, you really take the time with each patient to understand their needs and to help treat and help them achieve their health goals or their appearance or whatever their needs may be. So you're doing great work. We're honored to have you in our program. You're recognized as a top doctor in the community. I wanted to ask you an important point. Not only are you helping patients, but you're also giving back to the community. You have a foundation that's helped so many people. Can you tell us a little bit about it, what it does, and how it works?
Yes. I think starting back around 2006, Modessa Vasander, one of my nurse practitioners who's actually in Kenya right now, supervising one of the hospitals we've opened in Katani, Kenya, Katani Hospital. But Modessa Vasander and myself had a dream, we had a vision, which is we wanted to give back to the communities where we came from. Modessa grew up in rural Kenya. I grew up in rural Pennsylvania. We wanted to give back to the community. For example, at the age of 4, I decided I wanted to become a physician. Why? Because the community physician, Dr. Joseph Hunt, made house calls. And so I had chicken pox, which we were talking about earlier, some of the resemblances between SARS-CoV-2 and chicken pox. But at any rate, I had chicken pox, and so he came to see me. And I told my mama, I said, "Mama, I want to be just like Dr. Hunt." And so I hit first grade, told my first grade teacher about my dream, and Miss Helen, she said, "I'll help you." And then I hit 4th grade, and Miss Ruth Myers, my 4th grade teacher, she said, "I'll help you also." And so due to these teachers at a young age, I was able to become a physician growing up in rural Pennsylvania, the first physician in my family, one of the first people to be college educated. Went to Johns Hopkins here in Baltimore, stayed at Hopkins, got my bachelor's degree, master's degree, then was accepted for medical school at George Washington School of Medicine in D.C., and then did my residency training in family medicine, women's health, urgent care medicine, emergency medicine at the Medical College of Virginia in Richmond. Subsequently, then went into private practice and have been practicing continuously since that time. We wanted to give back to the community, and so we started the foundation with a dream and a goal of opening 300 healthcare facilities throughout the continent of Africa. We believe that strategically placed in the 54 nations of Africa, that we can make a difference. That is to provide a center of care, basic care, to every African and every nation. Because it's amazing that right now while we sit here, there are Africans that have died because they didn't have any fresh water. There's some Africans that have died because they didn't have any good source of protein or food. There are Africans who needed a shot or two of penicillin, antibiotic, and they don't have any access to it, or they have no money to purchase it. We were shocked and amazed at how easily you can save a life by providing basic, stable resources. So in 2018, November 2018, we opened Katani Hospital in Katani, Kenya. We're currently working with the Nigerians to open up a hospital. I'll soon be meeting with the president of Johns Hopkins to talk about possibly Johns Hopkins networking with us to play some role in opening up centers throughout Africa. And so our foundation is focused on changing healthcare, basic healthcare, to all Africans, because we believe that the most valuable resource that Africa has is the people. It's not their gold, it's not their silver, their coal, their timber, their wetlands, their water, their cattle. It's not those resources. It's the people. The people are the most valuable resource that every nation in Africa has, and we feel a very strong need to assist those patients, those people, to be all that they can be by providing basic health care. And so the foundation was created and is growing today. We have a number of corporate partners. Amazon has partnered with us, along with 15, 20 other manufacturers and businesses around the country have partnered with us. And today, we share a common goal. In fact, I'll be going back to Africa soon. I've been just waiting to see what happens with this surge in the pandemic, to make sure it's safe, safe for me and safe for me to travel, so that I don't, take any disease with me to Africa or bring any disease from Africa back to America. So we're just waiting on the timing for my return. In the meantime, Modesta has already gone back. She is acting as the CEO of Katani Hospital and is back right now. We're doubling the size of our surgery department. We're going from 2 ORs, operating rooms, to 4 operating rooms, doubling the size of the ER from 8 beds to 16 beds. We're installing a state-of-the-art GE CAT scanner, which will be the first in that region of Kenya to ever be in place. Also a total comprehensive body x-ray machine, head-to-toe x-rays, also looking at a mammogram. We're currently purchasing a Olympus scope for doing colonoscopies and for doing EGDs, upper endoscopies, because one of the greatest causes of death in Kenya and throughout Africa is colon cancer. It's very common. It often goes undiagnosed because there's no equipment to actually do the testing, the colonoscopy exam necessary. So we're looking at that. We're also looking at putting in mammography, and we'll be, by spring, having a mammogram available for our women, because another common cause of death is breast cancer. And again, women don't have any place to go to get the studies done, and so they often just put up with the lumps and bumps in their breast until they're advanced and too late to save. So these are some of the things that we're doing. We're working with Alliance Park in southwest Nigeria, to open a center there. Again, a 200-bed hospital in a gated community there in Nigeria. We are also looking at 7 other projects where we're acting as a consultant to help open hospitals and primary care throughout the 54 nations of Africa. Also would mention that we're working in partnership with an organization here in Tampa, Florida, called the Nigerian Business Forum, and the American Nigerian Business Forum specifically is a group of Nigerian businessmen that are focused on improving care throughout the African nations, starting with Nigeria, but we're actually looking at all 54 nations. We also are teaming up with the president of the African Developmental Bank. Dr. Denise is a friend of ours, has invited us to come over for a couple weeks. Dr. Denise and the bank, the African African Development Bank, wants to team up with us. He's very interested in making sure that all 54 nations have an adequate supply of water, clean, drinkable water. Number 2 is he has a dream, the bank has a dream, that they can provide sufficient food within each of the nations for each of the nations to feed themselves without any outside needs. Number 3 is he's looking at starting a series of small business owners. He's very business-minded, very interested in seeing businesses throughout the African nations to start forming small businesses. He believes that small businesses can become the backbone of a growing economy throughout the African nations. And our foundation, Sollay Kenyon Foundation, we agree. We support the bank in its efforts to provide that fresh water, fresh food, and to promote the starting of small businesses, which we believe if you teach an African family how to run a small business, then you're providing an opportunity for a lifetime. And that small business can be anything. You can give them a flock of chickens and they can go into the chicken business. You can give them one or two cows and they can go into the milk and dairy business and develop a herd of cows. And so the story goes. You can give them llamas and sheep and they can go into the wool business and sell the wool for a profit, and next thing you know they have a herd. And so all the people need is just an opportunity to improve themselves. And so the Sollay Kenyon Foundation is partnering with colleagues not only to provide the basic health care so that they can run these small businesses and be healthy, but also to assist our colleagues to start these small businesses, to see our patients start small businesses and to succeed.
Well, Dr. Baker, I have to say that is so impressive. You're helping so many people with their health and wellness and their appearance with your medical practice here at Sollay Medical and Cosmetic Laser Center. You're helping so many people around the world through your foundation. It's an honor and a pleasure to have you on our program. You're truly a top doctor, and I want to thank you, Dr. Baker, for being a guest and sharing this great information with us today.
Thank you very much.